has been such a busy day this week and today at the Capitol, but we've got some really, really good updates. It's budget day right now. So they're going to have a marathon on the House floor passing the budget. But I just want to encourage you, medical freedom, things are moving. We've got some great updates. There's some calls to action I'm going to need your help on, but hopefully we can roll through those things and you can be very, very encouraged by the things that are going on. And that's really what I want to start out with very quickly and just tell you the conversations, the hearings we are having, especially in the Senate right now, on medical freedom issues truly are unlike anything I've experienced in 10 years. We are having these bills where we are talking about medical freedom, informed consent, vaccine injury. And these are the type of bills where people used to show up in droves and testify against. We are not facing that opposition. Not only are we not facing that opposition like we have in previous years, it's been very encouraging for members of the medical community to come and talk to us and say, even though they didn't love all of our bills, and some of the big medical associations, not their favorite issue, they know these bills are moving and they expect them to move. And they know that they're going to have to stay neutral on a lot of them. So very, very encouraging. If you haven't watched any of the hearings, I would encourage you, when the bills are up for a hearing, hop online and check them out, because they've been very, very encouraging for anybody who stands and believes in medical freedom. So the first update I want to give you is SB 95. And this is Senator Bob Hall. And this is an informed consent bill that would require written informed consent at the time of vaccination. This is the risk, the benefits, and this is written consent outlining what to do in reporting a vaccine reaction. Okay. So it's informed consent like we haven't seen it before. So really, really good bill. And that passed out of the Senate today. And I was there, got to see that happen. The vote was 21-9. So super excited about that. And just so grateful to Senator Bob Hall, who has really just been leading on these issues for many, many years. So we're going to need your help when this gets over to the House, and I'll get to that in just a little bit. But that's a huge bill that was passed out of the Senate today. So very super excited about that. Senate Bill 754. This is the informed consent bill by Senator Mays Middleton. That bill has been referred to State Affairs in the Senate. It has not gotten a hearing yet. So I'm going to give you a call to action, and that's to email and call the State Affairs Committee and ask them to put that bill up for a hearing. And the chair of that committee is Senator Brian Hughes. I believe there's going to be an email follow-up to this Zoom. And so we'll make sure that you get that information and you have the follow-up available. The next bill is HB 1586. Guys, I'm telling you, we're moving a little in the House right now, and I have a meeting on opportunity to start moving some of our House bills. And so this is one that has been in his committee for a while. The chair, Lacey Hull of Human Services, has asked Chairman Van Deaver to schedule this bill for a hearing, and that request has not been honored or granted. So that is something that next week we're really going to start dialing up the pressure to get these bills moving in the House. So again, look for it to Chairman Van Deaver, and let's get that bill moving. Senate Bill 407, which is the vaccine exemptions for healthcare workers, was heard in the Senate yesterday. And once again, this was just a great hearing. We had 9 people show up to testify. Only a handful of those were opposing. They were from the Texas Medical Association, the Texas Hospital Association. And the conversations, I mean, the committee members are not letting these associations off the hook. They are demanding transparency. They're demanding answers. They're demanding, why aren't you guys standing for the patients that you serve? And so that's been very, very encouraging. And so to not Senator Mays Middleton for filing the bill, but Senator Colhorst, who has just been such a strong advocate for medical freedom and who is not shy and is not at all scared off by this issue of medical freedom. We're very, very grateful for her. Also, yesterday, Senate Bill 269 by Senator Charles Perry, which is the reporting of vaccine adverse reactions, that had a great hearing in the same thing. It was like very little opposition. The testimony was really great. The members asked very thoughtful, great questions that shows that they really understand this issue and they're ready to move forward with it. So both of those bills, we need to put some pressure on the committee, who's been fantastic, but now they need to vote it out and let's get that moved and let's get that over to the House. Senate Bill 386 by Charles Schwartner, the International Health Organizations. We are still waiting on a hearing from that in State Affairs. So that will be on your action list. Moving along here, we've got HB 4076. This is our organ transplant bill, and this is also in Van Deever's committee. Chairman Leach has asked for a hearing, and that has not been granted. So I talked to Leach's office today. We're really going to start dialing up the pressure on Chairman Van Deever to schedule these bills for a hearing. So I really need you guys to help me out here, and let's drum up some support and reach out to Chairman Van Deever and say it's time to give these bills a hearing. Not only the House bills, but now we have some Senate bills that are going to be coming over, and those are going to go through public health. So we really need Chairman Van Deever to be on board with moving these bills. The other two in public health are 4535. This is the COVID vaccine transparency bill by Representative John McQueenie, and 4587, which is a provisional enrollment bill for kids with vaccine exemptions by Representative James Frank. Both of those, again, in public health. Are you seeing the trend here? We've got some bills in public health we need a hearing for, and we need them to move. And again, we'll send you an email and we'll hope that you send that out to your groups, and let's get some action moving. The last one in the House is 4381, and this is by Chairman Cole Hefner. This is in the Public Education Committee, and this is a bill that would require school districts to inform parents of their parental rights as it relates to medical freedom. Talked to Chairman Hefner today. They've requested a hearing. We're looking for some expert testimony to show up and testify on this bill, but we also might have a vehicle for an amendment on an existing bill that would take this language and put it into a bill that's already headed to the House floor next week. So these are some really, really exciting opportunities for us to advance medical freedom priorities. But we are getting to the point in legislative session where I'm going to need you guys to reach out to your groups and start encouraging participation in some of these action alerts so that we can get these bills on the committee calendar and then through the calendars committee and then to the House floor if they have not been there already. So I want to end with a few updates. On Monday, I have been asked to join the Moms Across America as an advisor. And they are a great group that is really on the front lines of cleaning up our food supply, of drawing attention to the toxins that are in our foods. And they're tracking legislation all across the country. They're working very closely with Bobby Kennedy on reforms in our schools. And they have reached out to us at Texans for Medical Freedom. They asked me to be an advisor. And so I was able to hop on to a Zoom call on Monday and give those group leaders an update on Texans for Medical Freedom. So if you are not following Moms Across America, it's a great group. Again, they do these calls and they give updates on various different states' legislation. They've got some really interesting bills across the country that again are going to advance our rights as it relates to healthy foods and food labeling and getting the toxins out of our food. I think we can all agree those are some really exciting things. Bobby Kennedy has just concluded or is still on and has been doing a Make America Healthy Again tour. And I saw some breaking news coming out just a few minutes ago that him and President Trump have been talking about some research that is going to be published shortly in the next few months with updates on the autism epidemic. This is fantastic news for our families. Here in Texas, one of the things that I'm really paving and trying to get the legislators to think down the road is everything we're doing great with Make America Healthy Again. It's fantastic. It's wonderful. And hopefully that's going to set the next generation up for success in truly being healthy again. But we do have 30 to 40 years of this epidemic that we have created, this man-made epidemic. And it's pivotal we figure out exactly what is causing it. And we start to put strategies in place to care for these kids and these families who have been profoundly affected by this new epidemic of autism, allergies, ADHD, asthma. The list of chronic illness goes on and on and on. So this is so much bigger than just Texans for Medical Freedom. I mean, truly, we are part of the effort nationwide to ensure that we change the course for America's future and for our children. And so I'm going to close and just tell you, we need you guys to engage on social media, partner with us on legislative action alerts. We're going to have a lot coming in the next few weeks, and we really need you to reach out, especially, like I said, next week, we're probably going to have some action alerts to compel Chairman Van Beaver to act and to give these bills a hearing, and let's move them through the process. And so you will receive a follow-up email that will give you specifically what your steps are. And last, I think, and not least, of course, is our gala is coming up Saturday, September 6th. The tickets and the sponsorships are live now, and we will have those details also in the follow-up email, and we will include the sponsorship form. So if you have practitioners or groups or doctors or anybody who wants to sponsor or sign on as a sponsor for the gala, we need your support. So thank you guys for bearing with me as I was getting all of this set up. I hope you could hear me okay. Like I said, I'm here in Waco and I'm going to speak to a group tonight. I'm super excited about that. And then I'll head back to Austin and start working on next week's legislative agenda. So thanks for joining. Share this with your friends, these calls and these updates, and share the email that we are going to send with follow-up action alerts. All right, guys, thanks so much. You have a great night.